In this lecture, I will discuss about the femoral short fracture. Femoral fracture is the fracture of a thigh bone. Femur is also known as thigh bone. Femur is the largest and the strongest bone in the body. It mostly asked in the MCQs because it is largest and strongest bone, so it require a large or high impact force to break this bone. Most femur fractures are the result of a high energy trauma, any kind of trauma or accident, such as the motor accident, gunshot wound, or jump or fall from a height. The femur fracture can occur. It is a very serious condition and need 3 to 6 months to heal. It's a long time to heal. Femoral fracture can be classified as according to its types. There are three types: femoral head fracture, femoral shaft fracture, and femoral condyles fracture. Femoral head fracture, it's at the head. Femoral shaft fracture and the femoral condyle, this is the medial and lateral condyle. These are some types of bone fractures. This is the transverse, this is the linear fracture, this is the non-displaced because bone is at its alignment. This is the displaced fracture because bone is displaced to the right side. This is the spiral fracture in which there is a twisted form fracture. Green stick fracture, it's mostly common in the children, in which there is fracture on the one side and bending of the bone on the other side. And this is the comminuted fracture. This is the comminuted fracture. The treatment for this is according to its phases. In phase 1, post operative, it's of week 0 to 4. Inpatient physical therapy program, gentle range of motion exercises of the hip, knee, and ankle, and focus in knee extension. Lower extremity range of motion exercises. Next we have lower extremity isometric exercises. Isometric means which has muscles have same length. The patient is non weight bearing. We also go for modalities such as Faraday stimulation, muscle re-education, swelling control, and the pain management. Stretching of the muscles of gastrocnemius, soleus, and hamstring muscle. These are the extensors of the back of muscles of the lower extremity. We go for stretching and strengthening exercises of the quadriceps, femoris muscle setting, ankle dorsiflexion, plantar flexion, and eversion, inversion, all the motions, range of motion of ankle with the help of TheraBand. Straight leg raise in 4 planes, ankle pumping, balance proprioception means joint positioning, and gait retraining because this is our lower extremity. Balance and gait retraining is very important. Cup walking, start weight bearing with toe touch or according to the physician order or protocol. In the phase 2, it's of 4 to 8 weeks. We continue from exercises from phase 1. Also go for strengthening exercises, knee extension with weight up to 2.25 kilogram, toe or heel raise, mini squat, knee flexion with weights, standing hip abduction and flexion with resistance, so that strengthening occur, weight bearing, balance proprioception and gait training, side stepping, backward walking, conditioning exercises, bicycling, pool therapy also we do in the phase 2. And in the last phase 3, it's of 8 weeks to 18 weeks. Continue exercises from phase 1. Also go for strengthening exercises, knee extension with increased weight, step up forward and lateral. In the multiplanes, it's mean polymetric, single leg stand, mini squats, balance proprioception and gait training from phase 2. Also go single leg stand, balance, and proprioception activities on stable and unstable platforms so that the patient comes to its activity of daily living. Fitness condition exercises include treadmill walking. These are the phases that the patient, if successful in all this, so that the patient is returned to its normal life. In this lecture, we will discuss the femoral short fracture and its complete treatment protocol. I hope you like this lecture. Thank you.